Yes, hi, good afternoon. I can hear you.
All right, great. Okay, nice to have you. Now tell me a bit about your NCLEX journey. Let me hear again.
So I will be taking my NCLEX in a week.
Okay.
Um, a new grad, new NCLEX, um, new first time test taker, I should say. Just trying to build my confidence of because I can narrow the two answers down, but second guessing myself at times. And try not to put more into the answer than it needs to be and trying to justify why that answer is not right. That's something that I'm working on a lot. And other from that, it's just like just sticking to my gut feeling, stop
Mhm.
changing my answers. So I'm working very hard on those.
All right. So how do you feel about taking the NCLEX exam currently?
I mean, it goes and comes. The feeling goes and comes. So I just feel like I need to go ahead and do it now.
Okay.
Um, I feel like I'm ready. Most days I feel like I'm ready, and then there's those 1 and 2 days that I'm like, I'm not ready. Because you feel like you need to know everything. So I had to teach
Mhm.
myself I'm not gonna know everything. It's just so I've been focusing more on test taking strategies lately more than anything else, which has been of great help.
Okay. All right. So now basically let me just walk you through how you can pass the NCLEX exam. Now, in
Okay.
order to pass the NCLEX exam, it's always these three things. One, the content,
Hmm.
knowing how the NCLEX write the question, and
Hmm.
then understanding it. Now, do you know
Okay.
the content for the NCLEX exam?
I think I know a lot of content.
Okay. Um, Now this is it. Now, the reason why a lot of students feel not ready, feel overwhelmed, or feel not prepared is because they study content randomly.
Hmm.
Right. NCLEX understand one thing, right, about every student. NCLEX know the moment you are done with nursing school, you have every nursing school knowledge in order to what
Hmm.
attempt the NCLEX exam. Now, but you
Hmm.
have thousands of those knowledge, right? So now, NCLEX know with a lot of this nursing school knowledge, you will be overwhelmed. You will not be able to focus right,
Hmm.
and all that kind of stuff.
Hmm.
Like in nursing school now, the amount of questions you answer in nursing school, I believe will be more than 8,000. But on the NCLEX, you are limited to 85 all the way to what 150 question. Minimum 85,
Hmm.
maximum 150 question. So to study for
Hmm.
this amount of question, NCLEX don't want you to be all over the place. That is the main reason why they created a particular document. They call that particular document the NCLEX test plan, so that every student have the ability to understand what the NCLEX. But the problem is this, because when you start preparing for the NCLEX exam, you should walk through these three phases. Phase one, understanding the NCLEX. Phase two, planning. Phase three, study. But a lot of students don't do this. They don't do this. They only focus on this. Because the number one question every student asks themselves after they are done with nursing school is, what program should they use? The next thing they go get what?
Hmm.
A particular program,
No
which is
problem.
often
Hmm.
what? Question bank to start preparing for the
Hmm.
NCLEX exam. Without no knowledge of the NCLEX exam. Now, this is where the
Okay.
number one problem start from. Because now a lot of students are fitting in into the question bank way of testing. And when they go on the NCLEX exam, they start seeing a different thing entirely. Now,
Mhm.
I will tell you most things that students say when they fail the exam. Now, when the students fail the exam, when they come back and they want to restart the whole process again, the first thing most students always used to ask is, what program look exactly like the NCLEX? Because they feel like, okay, they need to have a program that have the same interface as the NCLEX. That is one thing.
Mhm.
Right. Most people say, oh, Asha exactly look like the NCLEX. Bootcamp look like the NCLEX. A lot of people will say different thing. Now, another question they always used to ask is, um, what program have the same exact question as the NCLEX? As well, because
Right.
now they want to go on the NCLEX exam and see the same exact question. Because one, a lot of stuff will go on the exam and it's a different interface, and they're like, they don't understand it. Maybe that's why they failed. Now, a lot of stuff will go on the NCLEX exam and say, uh most of the question they practice in the question bank, they are not saying it on the NCLEX exam, or they are not written
Right.
exactly like what the NCLEX exam. So it become another question. So people are trying to fix all these problem, right? They are trying to
Right.
fix all these little problem, thinking that is the reason why, or maybe they feel like that's why they are failing, right? So they feel like
Mhm.
if they can fix all these things, they can pass this time around. Now, I always used to tell students this, right? I always tell students, if you get a question bank, I'm not against question bank, right? But if you get a question
Mhm.
bank and you end up passing with a question bank, right? It's not the question bank that made you to pass. It's the existing knowledge
Mhm.
that you have that made you to pass. Think about it this way. Let us say you were not exposed to any knowledge, right? And then you just attempted a particular question. Are you going to pass that question? Obviously, no. You need knowledge to attempt question in order to what? Pass. Same with question bank. You already have all the knowledge you need in nursing school. So you have your nursing school knowledge. You got a question bank. You maybe the question bank, according to most question bank, they can put you high, very high, whether you're
Mhm.
ready for the NCLEX exam. Now you meet up with this standard, and then you take the NCLEX exam and you pass. Now most students will feel, oh, it's the question bank that made them pass. No, the knowledge you had is the one that made you pass. If you never had any prior knowledge, or you never learned one or two things, right, along your journey of studying in order to attempt the NCLEX exam, you will not end up passing the NCLEX exam, right? But
Right.
the problem now is the way a lot of students approach question bank. Now, in nursing school, we might do a particular test together. You are going to score 10 over 10, and me myself, I'm going to score 10 over 10. But the truth is, the way you score 10 over 10 is different from the way you score. Oh, I score 10 over 10. Your thinking process and my own thinking process will never be the same. Right.
Mhm.
We can both get the same result, but there might be a problem with the way we think. Right. Now,
Mhm.
guess what? We both now want to approach what? The NCLEX exam. Now, maybe the advantage you had when you were doing your test in nursing school and you had your 10 over 10, and I have my own 10 over 10. Now on the NCLEX exam, we are going to start spotting our area of what? Weakness.
Mhm.
The truth is, a lot of students don't pay attention to their weakness. Instead, they are lost in what?
Mm.
Rationale for the answer that is right, and the answer that is what? Wrong.
Mhm.
So they feel like they are learning this way. Instead, they don't know that what's going on is they only just understand the reason why a particular answer is correct or wrong related to only that question. Now, I always used to tell students this: the moment you are answering a particular question, right, before even selecting that question, if you don't have a perfect understanding about that question, you need to like start it, right, for review on the knowledge.
Mhm.
You don't attempt that question because it makes no sense attempting the question. You don't have any understanding about the question. You don't know what the NCLEX is the question bank program question is testing. You don't know what it is testing. You've not seen maybe that content before, and then you are trying to answer the question only to just wait to see if you get it correctly, or maybe you got it wrong and you want to now review rationale. You are not learning that way. Instead, you are deceiving yourself. Right. So that is the main reason why those people that tend to, because in nursing school, we can do a particular test together and get a particular result, but you don't know the struggle every student put into the test. So it's not about the result, it's about how you prepared for the test that got you the result. So some students are very
Mhm.
smart, right? Despite the fact they complain about difficulty and all that kind of stuff, but they are very smart. That's the main reason why when you check the NCLEX pass rates, you'll find out that this year, last year it was 94%. People that were
Mm.
taking the NCLEX exam for the first time.
Wow.
Now, this year, as at March, 88% first time. Now,
Mm.
guess what? People that are repeating it, people that repeated the exam, the pass rate is within 35 to 37%. So,
Mm.
people that are taking the exam the first time, this is the pass rate. People that are repeating the exam, this is the pass rate. It means that people that are repeating the exam, right, they struggle. So
Mhm.
NCLEX is a way of separating people that maybe they just like, how will I say it? Maybe somehow they shortcut their way through nursing school, or they don't really know so much. They just did anything or do anything just to just finish nursing school. NCLEX is a way, because trust me, I always used to ask students this question. I used to say, somebody that is seeing the NCLEX exam question for the first time and somebody that have seen the NCLEX question before, who should pass the exam? Now answer that question. I want to know your view. Somebody that is taking the exam for the first time, somebody that have taken the exam before, who do you think should pass the exam?
You said that someone that took the NCLEX test before,
Yes, and somebody that is taking the exam for the first time, who do you feel should pass the exam?
they would say the one that took it before because they saw what was going on,
Exactly.
right?
But yeah,
Hmm.
exactly. That's what I feel, right? But the
Yeah.
pass rate is not
So
saying
low.
that same thing,
Mm-mm. Right.
because it shows that they are struggling. So it means that there's a problem beyond what just getting what question bank. Now,
Mm-hmm.
when I was now trying to like find out the problem, I noticed that it's always these three things. As I said earlier on, the content, knowing how the NCLEX write to question, and what understanding it.
Understanding.
Right. Now, in order to pass the NCLEX exam the first time, every student that passed the NCLEX exam the first time always uh work hard on content. They try to understand what the NCLEX is saying by knowing how the NCLEX write the question, and they try to understand everything about the question to create what the correct answer. Now,
Mm-hmm.
but a lot of students, right, can study content at random and still pass. A lot of students cannot do that, right?
Mm-hmm.
Now, it's just like now in nursing school, maybe your lecturer is saying, oh, we have a particular exam on what? Med-surg. Maybe if they did not give you a blueprint, then you will have to what? Read different topic, and you will feel lost, overwhelmed, because you don't really have a focus point. But if they give you a blueprint which creates what a focus point, whereby the lecturer is telling you to read this, read this, read this, read this, read this. Now, you definitely know these are just what you need to what read or
Mm-hmm.
focus on. Right. So that
Right.
is how the NCLEX as well to work. Right. Most people that don't have focus points can still end up what passing that course. But
Mm-hmm.
most people need focus point. That is about the NCLEX. NCLEX want to give you a focus point. That is the main reason why they gave what the content. Now, we cannot know the content and then fail the exam. It's not possible, except if you did not study the content. Have you heard about the NCLEX test plan before?
Yes.
All right. Have you gone through
Is
the
that the
NCLEX
one that
assessment?
they told you about the different sections and the percentages?
Yes,
Is that what you're saying?
yes,
Yeah.
exactly. All
Yeah.
right. So you went through the content, right?
Hmm.
All right. So,
Yes.
okay. Now, if you have gone through the content, right, you will find out that you have eight category, right? This eight
Hmm.
category, right? Because you are taking the NCLEX-RN, and for the PN as well, it's also eight category. RN eight category, PN is also eight category. Now, these eight category are broken into what? Different session, right? Whereby the NCLEX will tell you out of 1, 2, 3, 4, 5, 6, 7, 8. NCLEX will say, okay, maybe this part we have the most question on the exam. Maybe this
Hmm.
part we have the least question on the exam, right? So NCLEX gave this breakdown. Now we know the eight category, but the missing thing right now is what will the NCLEX test in this particular category? What will the NCLEX test in this 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 category? That is what we need to now know. Now for the RN, if you add the content year, all the way to the number 8 altogether, it will give you what? 146 content. For PN, if you add it all together, it's going to give you 150 content. Now we already have a focused content to study on the NCLEX exam. Now at this point, it should be difficult to fail the exam because we know the content. A lot of students don't know how the NCLEX examiner think. Now, let me explain something to you. Be let me explain something to you. Now, before they created the NCLEX, something was done, right? We have the NCLEX, we have the NCSBN. The NCSBN is the writer of the question, the exam. The NCLEX is the owner of the exam. They don't write their exam. This is the writer of the exam. This body writes the NCLEX, RN, and PN. They also write exam for Canada, which is the REX-PN. Now, this body, what they do is to research, right? So they do like
Hmm.
research. Now, when they do this research, they try to find out the most important things that entry level nurse needs to know.
Hmm.
Now, when they find out what entry level nurse need to know, right? They now use those particular things to create the exam content. That is how it works. Now,
Hmm.
the information that is on the NCLEX exam were gotten from what? Nurses, nursing educators, different people. That, oh, nursing students
Hmm.
need to know this, nursing student need to know that, and all that kind of stuff. So the examiner already know what nursing students need to know.
Hmm.
So since they already know what nursing students need to know, now this information, they want to test you to see how you can use it to what? Practice
Hmm.
and show that you are what? A safe nurse.
Goodness. Hmm.
Right. That is the process. Now, let me now tell you something. Nursing school, right, offer you courses,
Hmm.
nursing school. But NCLEX offer you not courses. Instead, NCLEX offer you practice area. Nursing school give you the knowledge you need in order to attempt the NCLEX exam so that you can get what? Your license to what? Become a nurse, right? But you need to show that you can practice. Nursing school, you need to pass your courses to show that you have the necessary knowledge. But NCLEX, you need to be able to practice. So why nursing school is only give you the knowledge, right? The nursing school knowledge you need. Nursing school knowledge, I mean, to attempt the exam. NCLEX is trying to see if you are ready to become a nurse. So the reason why you finish nursing school now, you don't automatically what? Become a nurse is because a lot of people can bypass their way in nursing school, but you cannot bypass the NCLEX. You need to uh pass the NCLEX rightly. Now, and because if you finish nursing school, you cannot automatically what become a nurse,
I'm there. Mm-hmm.
right? So this NCLEX exam is like is a way of NCLEX trying to test to see if you become a nurse, you are going to be what, a safe nurse. So now you are practicing as a nurse. NCLEX is giving you the ability to practice as a nurse, same way you are going to practice when you start working physically. But now you are practicing as a nurse in form of what? An exam. But before they give you the license to start practicing as a nurse physically.
Mm-hmm.
So the NCLEX word is the same as what? Your when you start working as a nurse physically. So NCLEX is giving the ability to start working as a nurse. Now, no, the truth is a lot of students don't even act like a nurse when they're answering their question. They don't. They
Yeah.
still answer question like they are in nursing school. Now, nursing school question is all about knowledge base. NCLEX question is all about practice and safety. So you need to put yourself in position as a nurse. Now, my goal for every student that join my course program is that I want them to pass the NCLEX exam in 85 questions. Now, your 85
Mm-hmm.
question will be 85 situation that involve what? Care.
Yeah.
So
Mm-hmm.
this 85 situation, you need to show the NCLEX that you are what? A safe nurse. And that is the reason why we have those 8 categories. I call those 8 category the 8 clients needs. That is the main reason why I always used to talk about this category. Because now this category lets you know the area of practice, right? It lets you know the area of what? Practice. Now, if you have gone through the test plan, it will tell you just like in nursing school. Now, when you are in semester one, they will tell you, oh, these are your courses. Now,
Mm-hmm.
on the NCLEX as well, too, because if you don't know your courses, how would you be able to pass the semester? Obviously, you will not be able to pass. Same as the NCLEX. If you want to practice as a nurse, you need to know the areas at which you are going to show your ability to care. Now, that's the reason why the first part for RN is what? Management of care. NCLEX want to see how you manage what? Care. For PN,
Mm-hmm.
it's coordinated care. Right. The next part is safety, right? And infection control. Same thing for PN as well, too. So NCLEX also want to test your ability to be to maintain safety and also prevent what? Infection. So
Mm-hmm.
now we have an idea what is going to be on the exam. Management of care, safety and infection control, right? Now the third one is health promotion. Health promotion and maintenance. Same thing as well too. Right. So NCLEX want to test your ability to what? Promote health and maintain it. So now they want you to what? Be able to manage care, show that you can apply safety and what? Infection control in in your specific unit, and also be able to promote it and what? Maintain it. Now also they want you to what? Be able to what? Handle what? Psycho social integrity. We have next basic care and comfort. They are the same thing as well too. Right. Then you have next pharmacology and the parenteral aspect. Now for the PN, it's only just pharmacology. Right. Now, reduction of risk. Same thing. And then the last part, physiological adaptation. Same thing. Now, NCLEX wants you to be able to what? Fulfill all this area. So now we know what we are going to do on the NCLEX exam now. The only thing is, okay, now at this point, me, I will be telling myself, I'll say, okay, right now, I know on the NCLEX exam, my 85 question will make me manage care. It will make me sure that I can maintain safety and also what? Prevent infection. My question is also make me to will also make me to promote health and maintain it. My question will cover what? Psychosocial aspect. My question will cover what? Basic care and comfort. My question will cover pharmacology and the parenteral aspect because me, um, I took what? The NCLEX-RN. Now, my question will also cover what? Reduction of risk. My question will also cover what? Physiological adaptation. So now I know what to expect on the exam. But what is missing right now is I don't know what the NCLEX have in mind in this session, right? What they want to test me in each of these sessions, I don't really know as at yet. But if you go on the test plan, right, you are going to now find out that each of these category, NCLEX has already listed what they will test in management of care, right? For safety and infection control, NCLEX has listed. Same thing for all, right here. NCLEX has listed. That, so when I added everything all together, it's 146 for RN. And when I added the one for PN, it's 150. So now, and I know that once I study this 146 content, I should be able to answer questions related to management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, pharmacology, reduction of risk, and physiological adaptation. Now, at this point, it's difficult to fail the exam because we now know what? The content. Now, the next thing that you are going to be looking for right now, right, is question. So this is when you now need question. So at this point, you can decide if you want to get a question bank to start testing the existing knowledge you have, because you initially need to go through all this content first. Because it makes no sense to me going on the NCLEX exam without not knowing the content. Even if you feel you know to some certain content, at least go on the test plan and confirm if you have an idea of the content NCLEX is trying to test. And go through the content one after the other and start asking yourself, if I am to see a particular question related to this particular content, will I be able to answer it? Till you are done with the 146 content or 150 content. Now, when you have gone through everything, you will find that the areas you know and the areas you don't know. Right. Because now, if you, like most students that will fail the NCLEX exam, they are going to get what? A test report. Now, that test report is going to tell you the area you have what? Because NCLEX grade in 3 formats: above, below, and near. Right. That is how NCLEX grade in 3 formats. So for management of care, they can tell you whether after the exam, if the student fail, they would tell the student if they had above, below, or near, right, in each session. Because at the end of the day, if you have covered audio content related to management of care as NCLEX listed them, you should be above the passing standard. I see no reason why any student should not be above the passing standard. I see no reason. Honestly speaking, I see no reason. And I have not seen any reason, because people that end up failing the NCLEX exam, they come to me and they pass. Right. So, yeah. So passing the exam, that's why I said, from my experience, for the last 2 years that I've been coaching, it's always this 3 things: the content, knowing how the NCLEX write the question, and as well to understanding it. Because this is the same approach that I use for a particular student who failed the NCLEX exam 14 times. And she ended up passing on her 15 attempts. She's not from the US. She's from Philippines. She barely understands English, and she passed. Another student who failed the NCLEX exam 7 times. Not only she failed the NCLEX exam 7 times, she gave up for 10 years. Came back, right? Because I helped a particular student to pass the exam after failing 1 time. Right? She passed. So randomly, she just posted her ID card, her RN ID card, and somebody reached out to her and said, "Oh, you are a registered nurse now. Congratulations. How did you do it?" And then he said, "Oh, she got a particular coach, whoever." I said, "Okay, please, I need a particular that same coach that can help my sister." That was how I knew this particular lady. Right. And then she was like, "Oh, I failed the NCLEX exam 7 times, this and that. One thing I want you to know about me is that I have not attempted it in the last 10 years. I gave up." I said, "Okay, let's do this." And she ended up passing the exam in 85 questions. This particular student ended up passing the NCLEX exam in 86 questions.
Mhm.
85, 86. Right. So passing the NCLEX exam is not difficult. Right. You just need to understand what is making you not pass the exam. The moment you can understand that, because you've done the biggest part of nursing school, which of nursing, which is nursing school. So not you finish nursing school, nothing is stopping you from passing it. The only thing you just need to do is to be honest with yourself. If you feel like you shortcut your way through nursing school, then you know you need to start learning a lot now before you attempt the exam. But what I see right now is a lot of people trying to rush to take the NCLEX exam. A particular student told me, "Oh, she's ready to take the NCLEX exam." I told her, I said, "With what I have seen, I am not sure you are ready to take the NCLEX exam." She
But you
said,
know why
"But
they do that, right?
tell me."
Because our professors, before we finish school,
Mm-hmm.
what they do is they make us apply for the licensure
Okay.
and do our fingerprints and everything early so that as
Oh.
soon as we graduate, they
Mm-hmm.
send over the paperwork to them and they tell us to go ahead and take it right away because we have all the content that we need. That's their
Yeah.
words.
Wow.
So some of us, so my graduation was in April, and they were like, as soon as you didn't take it yet, wait to wait, and that
Oh.
was the pressure that's put on a lot of us. So that's why a lot of students go ahead
Mm.
and take
And
it,
take
and
it.
there you go. Yeah. So
Wow.
it's the pressure. Like I said, nurses, you said it right. Because I find that I've learned more being out of nursing school than being in there. And plus, I did an accelerated program too.
Mm-hmm.
So it was a lot to accumulate. Secondly, like I said, this is a complete new world for me.
Yeah.
So it's about taking away bad habits and
Mm.
doing professional habits. Even though you have a
Yeah.
kid, you do bad habits because it works and so
Exactly. Yeah,
and
you
you're
you
right, we need that push to know how to coordinate, but they don't teach us that unless you reach out to resources. The first thing they tell you, get test banks, just
yeah.
like you said. And that's
Mm-hmm.
how I started out, and then I was like, wait a minute, I'm losing it. So I restarted again and did some content, and then I focused a lot on my test taking strategies because I found for me I can have all the content in the world, but
Yeah.
then I wasn't applying it appropriately
Yeah.
to the questions.
Hmm.
So when I switch it and start focusing more on test taking strategies, like what are some of the things I can look at and stuff, it kind of helped me more to put the content that I've learned to
Yeah.
better use, if that makes sense to you.
Yeah. Makes sense. Makes sense.
Yeah. Okay.
Yeah. Yeah, so you are definitely right. So that's one of the reasons that we cause a lot of students to fail, right? This particular student failed the
Hmm.
NCLEX exam 3 times, and she said, "Oh, coach, I'm answering questions correctly now, so I can take the NCLEX exam. Let me fix a date." I said, "Don't fix a date yet. You don't feel you are not ready. It's not about answering questions correctly. It's about understanding how to think like the NCLEX.
Hmm.
Currently you are answering questions that are related to knowledge base. You are not We have not
Right.
started putting them together to make actual what nursing thinking. So you have knowledge base understanding, but now let's start putting it. He said, "Well, I've done this." I said, "Don't take the NCLEX exam." Right? I don't know.
Mm.
You know, most people always used to tell themselves according to what I know that, oh, take the exam, take the exam. So
Hmm.
maybe someone told her that she should take the exam. She decided to take the exam, and then she ended up what? Failing the exam. Then she reached out to me. She said, "Oh, I knew I should not have taken the exam." Something like that. I said, "So why did you end up taking the exam after I told you you are not ready?" Because I understand the process of the NCLEX, so I can easily tell you if you are ready or not. Right. So, and then she said, "Well, things change, family issues, and all that kind of stuff." So most people take the NCLEX exam not when they feel ready, but maybe because of situation or something like that. I saw a particular student who failed the NCLEX exam also. I said she took the NCLEX exam because of she need money, and then she ended up what failing the NCLEX exam.
Hmm.
Right. What you need.
And you know why she said that? So let me give you an hint and so
All
for
right.
further future.
Yeah.
The reason why she said you need to take it for money is like the
Mm-hmm.
situation that I feel when I finished school or even before I finished school, I was looking for a job. So every
Okay.
time they ask you a question is, did you take the NCLEX? When is your
Yeah.
test? I went on
Mm.
a couple of interviews and they said to me, oh, you're about to take the NCLEX. I don't want to train you now, and then this happens. But I'm like, okay, you train me now. I need to gain experience to get better and move on to your job. So it'd be best you
Yeah.
start training me now. They don't
Yeah.
see it that way. So a
Mm.
lot of people, like right now, I've been looking for a job, and the first thing everyone tells me, even though we have that NCLEX paper that says we are safe to start working for the next 3 months after we
Mm.
apply for that NCLEX. They still won't put us on for it.
Wow.
They're fighting us against it. So a lot of people are like, that pressure. And unless you educate yourself and try to figure out where do I go with this, you
Mm-hmm.
people don't know because the majority are telling them taking it right away. One of my aunt that's a nurse, she's like, when you graduate, she's like, you graduate the 18th, take the exam the following week. I'm like, what? Who? When? Where? I'm like, it don't work like that for me. You know what I mean? So it's that amount of pressure that a
Yeah.
lot of people are under that says, if I don't take the NCLEX, I don't get to get a job. You
Mm.
understand? That's the
Yeah.
stigma
Yeah.
that's out here right now, which is sad.
Yeah.
Because I'm
Definitely
upset
very
about it,
sad.
but I'm keep on pushing. Yeah, you know.
Yeah. Definitely
Mm.
sad, and I understand. Wow.
Mhm.
Now, so
Mhm.
what everyone need in order to pass the NCLEX exam, as I'm saying, one, you need the content. Two, you now need to understand how the NCLEX write the question. Because I want to quickly show you how NCLEX think. Now, when NCLEX want to write the question, it's different from the way lecturer write their question. The NCLEX examiner,
Mhm.
right? The video is out there, but most students only pay attention to question bank, so they don't even pay attention
Mhm.
to how the tutorial NCLEX, the writer of the NCLEX is giving out. Now, the NCLEX examiner know that they want to test to see if you can practice and see if you are a safe nurse. The aspect of practice is what? The eighth category, I wish I call the eighth
Mhm.
client need. The aspect of being a safe nurse is the sixth concept. Right. This is how NCLEX tests
Mhm.
to see that you are a safe nurse. They utilize what? The six concepts. When they want to pick a content, they pick it from the eighth category. Remember, I said RN have 146 content and the
Mhm.
PN have 150 content. So they have a lot area to like pick a particular content
Wait,
from.
hold on. Hold on. Before you go any further, I don't want you going any further than that. Can you start again when you the first circle that you wrote, I got that, but I got lost when you start talking about the 8 categories comparison to the six.
All
Just
right.
quickly, it just went over my head.
Okay, no problem. Now, this is the examiner, right? Like the exam
Right.
writer.
Mm-hmm.
So now the exam writer, when they want to write the question, because the
Mm-hmm.
approach of the NCLEX is to test to see that you can practice and to test to see
Mm-hmm.
that you are a safe nurse. Right. So the exam writer knows that they want to test to see if you can practice to see if you are a safe nurse. So now the area of practicing is the eighth category. As a nurse, you need to be
Okay.
able to what? Fulfill these eight client needs, right? This eight client
Mm-hmm.
needs comprises of what? This amount of content. For RN,
Okay.
146 content, for PN, 150 content. Now, but the content is just there, but how will the NCLEX see that you are a safe nurse? That is why NCLEX utilize what? The six concept. NCLEX use
Mm.
the six concept to see that you are a safe nurse. Like now, every content can be tested in six different ways. Like, let me give you the six concept. We have concept one, caring. Concept two, clinical. Let me just write it for. Concept two is clinical judgment. Concept three is nursing process. Concept four is communication and documentation. Concept five is culture and spirituality. Right? Concept six is teaching and learning. Right. Now, NCLEX will just pick one content right here, right? When they pick a particular content from this 146 or 150, NCLEX writer will now decide to test either the ability of you as the nursing student to care, to do clinical judgment, nursing process, communication and documentation, culture and spirituality, teaching or learning. Now, you have not taken the exam before, so you might not be able to relate to what I'm saying. Now, most students that have taken the NCLEX exam before, like the clinical judgment is your case study. So NCLEX can pick a particular content right here and decide to test it in form of case study. Your case study is in 6 session, right? It has 6 questions in
Mm-hmm.
one, right? So that's
Right.
your recognizing clue, analysis of the clue, prioritizing hypothesis, generating solution, taking action, and evaluation. NCLEX can just pick a particular content here and decide to say, okay, let's put that content, let's test that content in form of what? Clinical judgment. Now, on the NCLEX exam, there's a particular question that wishes to say, you are planning care for a client who has so and so. Which of the following intervention should you include in the plan of care? That is nursing
Mm-hmm.
process question. Right. People that have taken the NCLEX exam would have seen this kind of question a lot on their exam. Now, communication and documentation is a way of NCLEX testing to see how you pay attention to communication and how do you document as well too. Right. Is that the NCLEX can test you on how do you communicate with the client, staff member, or the NCLEX can test you on how do you document a specific care that you carried out, or how do you see the importance of documentation? You know, when there is a particular error, you need to document it, such as
Right.
maybe medication error, a particular incident, near miss. You need to document all these things. And also, how do you document care? You inserted
Mm-hmm.
a peripheral venous access device. How do you document it? NCLEX test all those things, right? Now, same with
Mm-hmm.
culture and spirituality. NCLEX also tests to see how do you respect a client what? Culture and spirituality. And do you also know what you do when a patient say this is what they want, this is what they want? Because NCLEX want to make sure that you are a nurse that respects a client
Mm-hmm.
what? Cultural aspect and what? Spiritual life without not
Mm-hmm.
being judgmental, right? Now, the
Bias. Mm-hmm.
teaching and learning aspect on the NCLEX exam involve what? If you've taken the NCLEX exam, you would have seen the particular question that said you are teaching a client about or you taught a client about. That is how NCLEX write
Mm-hmm.
those kind of questions. So that is how
Right.
NCLEX is trying to test teaching. Now, the learning is the aspect of when the NCLEX is saying you attended a staff education program about, or you attended
Mm-hmm.
a staff education program about. That is learning.
Mm-hmm.
So now, all these things, if you ask people, right, that have taken the NCLEX exam, these things I said are familiar to them, but they don't know it because they don't know this is how NCLEX writes the question. So the moment you
Right.
understand that this is the sixth way the NCLEX writes the question. So now, before we take the NCLEX exam, we already know what the NCLEX want to test. Now we know the content, we know the six concept. The only thing now you just need to start practicing on is if I see a question related to caring, how would I know? Now we know clinical judgment
Mm-hmm.
because obviously clinical judgment is what case study. Nursing process as well too. You should know it because if NCLEX is testing you on assessment, NCLEX will say you are assessing a client. You will know, right? Intervention, you will see it. Which intervention should you include? If it's evaluation, NCLEX will say which of the following require immediate follow up, immediate attention, or something like that that shows evaluation. Communication as well
Mm-hmm.
too. You will know if NCLEX is testing your communication and documentation. Culture and spirituality, all these things are straightforward. Teaching and learning as well too, they are straightforward. Now, but this is the part that most students don't really understand because they feel like, oh, you are trying to give medication, treat the patient. That is caring. No. On the NCLEX exam, caring questions are your therapeutic communication question because all you just need to do is to interact. There's no medication in that kind of question. There's no like treatment in that kind of question. It's just interaction with the client. The question can just be like, you entered the room of a client and you saw the client crying. What would be your
Mm-hmm.
appropriate response? Right.
Right.
So that is how NCLEX test caring question on the exam. Now we understand now because this is what I do. Like I explain all these concepts so that students go on the NCLEX exam, they're able to think. I explain all these concepts. That is my teaching point when I'm making a particular course, like a particular teaching on a particular content. I make sure I touch the caring part of that content, I touch the clinical judgment of that content. I touch the nursing process of that content. I touch the communication and documentation of that content. I touch the culture and spirituality part of that content, and I touch the teaching and learning, because that is what the examiner will test, right?
Mhm.
So every video session that I have on my course program contain all these things related to each of these content. So that is why when a student join my program, they cover everything, regardless of if they have failed the NCLEX exam before, in as much they can pay attention and also like do it right. Trust me, they end up passing the exam, because I walk students through this process, right? Because my coaching program is what? 8 weeks program. So I pretty much walk the student through this process. So 8 weeks, the first 4 weeks, we do what? The content. So we should finish the whole content within 4 weeks. Now, the 2 weeks again, we do question. Now, the last 2 weeks, we do strategy. Right. Now, the content, after the content, I give readiness assessment. So I expect at this point, students should meet up what? 60 to what? 90% pass rate. Now, when I start teaching strategy, I give another readiness assessment. I expect students should meet up with 75 to 95% pass rate. This way, I know the student is what? Ready to
Ready?
pass the exam.
Mhm.
Right. They are ready to pass the exam. So this way, I'm able to walk through. I'm walking through the process with the student. So the student is not doing it alone. We are doing it together. Right. So they will never even feel overwhelmed. They will never have anxiety, because I am guiding through the process. So, right, when we are done with this, and they feel ready to take the NCLEX exam in just what? 8 weeks of the course program. Same thing that NCLEX wants you to think. That's why when students go on the exam, previously before, if you ask a particular student that maybe attempted the NCLEX exam, they will tell you, oh, I don't really remember I'm overwhelmed. I cannot even remember the question. But guess what? When I ask students that have taken the NCLEX exam after joining my program, they remember a lot, because everything look familiar. Unlike before, when the students go on the NCLEX exam, nothing look familiar. They feel like they are taking a different question. They feel like NCLEX is difficult and all that kind of stuff. I guide you through the process. Most of them will complain and they will be like, why is it that every NCLEX answer look the same? That is how NCLEX writes the question. NCLEX is not about
Mhm.
NCLEX is trying to see if you are a safe nurse. So the right answer to look correct, but in between those answers, there is a particular word or statement that make the whole answer incorrect. Right.
Mhm.
Now, let me give you this last thing so that you understand how NCLEX is not like nursing school question. NCLEX is have a different
Mm-mm.
approach entirely. Now, nursing school,
Mhm.
right? The only problem with nursing school question is trying to figure out the question itself. When you get to the point of the answer, it's not difficult again. The moment you can figure out the question, you can easily select the answer. But on the NCLEX, you need to what? You need to understand the question, right? And you also need to understand each answers. You see how NCLEX make the process somehow
Mhm.
challenging. That is the reason why it's
Mhm.
not enough to just know the content. It's also important to know how NCLEX as well to write the question. That's why I tell students that NCLEX have what? 3 parts to every question. We call those parts what? The body, the stem, and then the answer keys. Right. According to the NCLEX, right? The NCLEX writer, right? They they will tell the examiner the body should contain a specific content that were listed what in the NCLEX test plan. So that's the reason why I tell students,
Mhm.
if you are not using the NCLEX test plan to study, maybe the student like to fail. I don't know, but trust me, this is what the examiner will do. When they are writing the body of the question, they are going to look at the content in the test plan, and they will test that particular content information when you read the body of your question. So every student have the ability to know what the examiner is testing. Because when you check the body of the question, you should be able to say, oh, this is the content that the examiner is testing. But that is not enough. You need to also pay attention to the STEM, because the STEM is now the examiner question. Now, this examiner question is related to that 6 concepts that we discuss. So now the content and then the six concepts. And when the examiner is writing the answer key as well, too, they don't just write straight answer keys like nursing school. The answer key also, they try as much as possible to put little confusion in the answer key, make the answer key look
Mm-hmm.
correct so that you can figure out, because NCLEX is trying to only accept what? Safe nurses. So how will
Mm-hmm.
they do it to make sure that the answers are not just straightforward? Nursing school answers are straightforward. NCLEX answers are not straightforward. You don't need too much critical thinking to answer NCLEX. You just need to be able to spot something that is wrong, because that is how NCLEX think.
Mm-hmm.
NCLEX writer will say, what are the common misconceptions that is related to this content? What are common things that nurses always used to do not in the right way, right? Now, NCLEX will now
Mm-hmm.
put all those things together to create what? Answer key. Now, let me give you
Mm-hmm.
an example of nursing school question and NCLEX question so that you understand the process. Now, this is NCLEX right here. This is nursing school. Now, the both question are testing on what? Blood transfusion, right? So, blood transfusion. Now, answer one is verify with another nurse. Answer one for the NCLEX is also verify with another nurse using client room number and ID band. Right. So
Mm.
then two, there's answer three, there's answer four, there's answer. So two, there's answer, right? Three, there's answer four, there's answer. Now, this is nursing school question right here, and this is NCLEX question right here. So they are testing on blood transfusion. Now, NCLEX is asking you to select
Mm-hmm.
the answer, correct answer. Nursing school is asking you to select the correct answer. Nursing school, the moment you figure out what the question is testing, the answer is straightforward. But NCLEX, the moment you figure out the question, you need to figure out the content. That's the difference between nursing school and
Mm-hmm.
NCLEX. The content, what the examiner is saying, and then the answer. That is how you think as what? A safe nurse. Right. So now look at this answer. Verify with another nurse. Is that correct related to blood transfusion? Is that correct?
Yes.
All right. Same thing as this as well. This is correct as well to related to what? Blood transfusion. Now, tell me, what is the difference
Mm-hmm.
between this number one answer and for the nurse for nursing school and NCLEX answer? What is the difference?
They just add more information to it, but it's really nothing because you are supposed to verify the client and their ID band to make sure that's the right client that you're doing, right? But
Okay. So now, if you see this particular answer on the NCLEX exam, are you going to select it or you are not going to select it?
well, if that's the safest answer, depending on what else they ask me, I'll probably pick it because it said using the client, well, not the room number. There you go. It says room number.
All right. So
So
that's what
you
I'm
don't want to
trying to.
use room number.
Mhm.
That's why, right.
Exactly.
So
That's what
see,
I'm trying to get.
that's where my problem comes in. Like I'll quickly get it, but then I'm teaching myself to go back and read it again because I'm one of them that quickly say, yeah, that's it. But I've learned to stop again and reread it. You know.
Yes.
Mm.
Now, that is how NCLEX writes every answer key on the NCLEX exam. There are two ways NCLEX write the answer keys. Should I say two ways or maybe four ways? But I feel like three of them are the same way, but one is just standing out. All right, but me, I consider it as
Mhm.
two ways, but there are four ways NCLEX write the answer keys. Now, this is one way. NCLEX will find one bad practice and include in a correct looking answer to attract you to that answer, but you need to spot something that is
Mhm.
wrong in it.
Right.
Right. Do you know that you can put on your sterile
Mhm.
glove and still contaminate your sterile feed? Do you know that?
Yes.
Okay. Because obviously if you put on your sterile glove, you also should make sure that you don't like wet the sterile feed, right? That is one. Two, you don't touch the edges. You don't
Mhm.
turn your back on your sterile feed.
Mhm.
All those things contaminate the sterile feed.
Mhm.
You don't just put anything on the sterile
Yes.
feed. So putting on a sterile glove don't guarantee
Total
uh
fluffs. Right.
exactly. So
Mhm.
NCLEX might not tell you how do you maintain sterile feed and put sterile glove. At first, this will easily attract you to feel like, oh, it's correct. But in between, they will add something that contaminate the sterile feed to what? Make it what?
Mhm.
That correct looking answer, a wrong answer. But now, nursing
Mhm.
students, a lot of nursing students have what we call short span. So when they want to read the
Mhm.
question, they only want to pay attention to what look correct or what they are expecting the answer to be like to be able to say it's correct. They don't pay attention to reading every words. And that is dangerous because
Mhm.
it's important to read every word in that answer because NCLEX will put something that make the answer incorrect. So verifying with another nurse, yes, it's correct. Because now when the particular student selected this answer, I told the student that answer is not correct. Do you know what she said? She said, Favour, I bet that answer is correct. My lecturer told me that we should verify with another nurse. I said, yes, I know. Your lecturer can tell you, but read the answer
That was the
very
only
well.
point she kept stressing on.
I'm telling you, that's what
Mhm.
trust me, I'm telling you, this student completely went through the whole answer. She said, verify with another nurse using the client room number and ID band. She said, yes, we do that. There's nothing wrong. While we were on the
Mhm.
Zoom, she I was hearing her opening a particular note. Immediately, I just saw a message on WhatsApp, and I opened the message. She sent me an image of where she saw verify with another nurse again. She said, am I saying it now that we verify with another nurse?" I say, "I'm not
Mhm.
arguing with you that we don't verify with another nurse, but read the question carefully." And then she said, "But I'm
Mhm.
not seeing anything that is wrong because the truth is this, right? Because on my
Mhm.
Instagram page, I run questions. I post questions on my Instagram page. That's what I just do mainly on my Instagram page. I see the way a lot of students think when they're answering questions. Most students
Mhm.
come on the NCLEX
Mhm.
exam with expected answers. You don't come on the NCLEX exam with expected answer. You come on the NCLEX exam to see the answers that the NCLEX have for you, and you think through those answers. If you come on the NCLEX exam to see
Mhm.
a specific answer, then you are not preparing for challenges. Instead, when you see a particular question that don't have the answer you expect to see, then automatically you don't know how to answer that question. That is how it
Right.
is. So that is how a lot of students. So now this particular student believes strongly that this is correct. So that's only what she's focusing on in that particular question. She's not even seeing the fact that room number or bed
Mhm.
number is a red flag. She's not
Mhm.
seeing that because her interest is just this statement that is correct. So automatically she feel because of this
Right.
statement, everything is correct. That's why I wish you to say this. Understanding the NCLEX is
Mhm.
the first thing. Now, when I told her, do we use room number to as a means of verification? She said,
No, because I
oh,
can't
oh,
change.
oh, oh, oh. She said, no, 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 we don't do that. I said, all right, you see, that is the problem.
Mhm.
She said, oh,
Mhm.
you see, they don't understand the NCLEX. And this particular thing right here is 1 point because she got that one wrong now. It's 1 point. And 1 point can be costly on the NCLEX exam. I'm going to prove that to you now so that you know 1 point can be costly on the NCLEX exam. But before I prove that to you, let
Very.
me give you another answer on the NCLEX. What I gave you right now is from the NCLEX past question. Now,
Okay.
there's another
And you
one
know,
that said,
one thing someone also taught me to do is when I'm so confused with the question, try to
mm-hmm,
read it backwards.
yeah,
Because sometimes when I read it backwards, I'm like, oh, I pick up something right away. So I was like,
okay,
oh, okay. Because if I'm reading it three times, like how
yeah,
she did, and she kept
yeah,
reading it, I tell
yeah,
them, I said, read it backwards and see what it says. Band client, you know,
mm-hmm,
number room. So you're like, number room client. You're like, wait a minute. You know what I mean? So when I find myself doing what she did. And I'm like, but
mm-hmm,
it's right. Because that happened to me the other day and I still clicked. I knew the answer was right and I still
yeah.
clicked the wrong one.
Hmm.
So I've been working on that too. So that's a good hint to use. Yeah.
Yeah, yeah. Now, NCLEX had a particular answer again. The NCLEX said use Y tubing along with lactated ringers. Now, this answer, when we are doing blood transfusion, obviously 100% we use Y tubing sets. True of us.
Mm-hmm.
Now,
True.
but this is what the NCLEX is using to attract you to the answer. Y tubing sets.
Mm-hmm.
Because now when you see Y tubing set, I'm telling you, most students don't want to read anything again. The moment they just spot
Mm-hmm.
something that is correct, that is it. They are done with reading the
Mm-hmm.
remaining statement. I've seen this all the time. It happens all the time. It will happen all the time. So now they are, that's why this particular student or this set of students will complain that every answer seem correct. That is how NCLEX write it. NCLEX is not writing answer to be
Mm-hmm.
totally wrong. NCLEX is writing
Mm-hmm.
answer for you to show that you are a safe nurse. You can easily spot that particular thing that is wrong. So white tubing is
Mm-hmm.
correct, which you should know. But guess what? We don't do lactated ringer for what? Blood
Saline.
transfusion. So
No,
it's the
always
lactated
monosaline.
ringer that is making the answer wrong. It's not white tubing.
Mm-hmm.
So if you focus on white tubing, you would have selected this answer and you would have moved on. But if you focus on
Right.
everything, you would have spotted that red flag in that correct looking
Yep.
statement. We don't use lactated ringer. We
Mm-hmm.
don't do what? Dextrose as well too. We only do what?
Yeah.
Normal saline.
No saline. Mm-hmm.
Right.
Mm.
Same NCLEX also said you should
Mm.
what? You should insert what? Peripheral venous access device. Yes, before doing blood transfusion, we want to insert peripheral venous access device. But NCLEX now said 24 gauge or larger. That is where the red flag is. We don't do 24 gauge. Instead, we do
Mm.
18 to 20 gauge. So it's not about yes, we insert. It's about is the gauge correct? So NCLEX, this is
Mm-hmm.
how NCLEX write the answers. So is that's the reason why I wish you to tell students there's three parts to the NCLEX: the body, the stem, the answer key. You need to understand how the body of the question work, how the stem of the question work, and how the answer keys as well to work. This way, if you put all together,
Mm.
you will successfully go through the 140 content for RN or 150 content for PN, and then understand how the NCLEX what write the question, right? Utilizing the six concept, and you will be able to break your answer key successfully, and 100% you will pass. So this is what my coaching program uh is all about, right? Coaching program is all
Mm.
about. So that is where we walk through it. You definitely would pass the exam. So you are taking your NCLEX exam now very soon, right?
Next week.
Yeah, next week.
Oh.
So the thing
Mm-hmm.
right now is um uh, the thing right now is most of the time I try as much as possible. If the student don't even have much time, at least minimum 30 days, right? At least to be able to like work with the student to be sure that the student can pass. Right now that you're taking your NCLEX exam very soon, I don't know what you know and I don't know what you
Mm-hmm.
uh don't know. Because if it's that you've taken the exam before now, maybe you are taking it again, I can easily go through what your test report and see what you know and
That's
what
true.
you don't know. Right. So
Right.
the only thing I can do right now in order to help you out, right, which I don't know how that will be helpful, is to see how you answer question. That is the only thing I can do. So I can easily not guide you through, right, most things. But what I can tell you for sure for your exam, the most important thing that you need are these areas. One, you need to revisit what the NCLEX test plan, and you need to focus on this important area because one area have 18% of the exam, 16%, 14, 13%, right? 13%, and then we have
Mm-hmm.
12%. This area is your management of care pharmacology, right? 14% is your I don't know if it's safety and infection control, but One is your reduction of risk and then physiological adaptation. So one of them, I can't really remember the percentage like that. But right, but at the end of the
Yeah,
day,
you're right so far. I'm looking at it. So you're doing right.
okay. So at the end of the day, if you add all this together, it gives you what? 73% of the exam. Now,
Mm,
if you have 73% of the exam, what it takes for you to pass the NCLEX exam is 60%. So if you have 73% of the exam, you've beat what? The minimum uh student ability, right? You 73%. Now,
right.
this is what I call the 5 key areas you need to know for the NCLEX exam. Then all you just now need to know is how to answer chat question, bow-tie question, and case study, because NCLEX is important. NCLEX focus more on these areas as well too, right? Because this is the new session of the exam now, new generation NCLEX. So NCLEX focus on this area, NCLEX focus on this big area. So put the two together, you are going to successfully pass the NCLEX exam in its 5 questions. Now, what you now need to start doing right now is
Mm,
you need to go through those content and start asking yourself, do I know this? Do I know that? Do I know this? Do I know that? Do I know this? If I see question on this, will I be able to answer it? Also, you need to know the important part of the exam as well too, because not only the content, right? NCLEX also focus on the most important aspect of care. Management is the most important aspect of care, followed by I'm not even using the percentage right now. I'm using management is the most important part of care. There you have prioritization. That's the reason why a lot of students will say, "Oh, I got a lot of prioritization question." It's the most important aspect of care.
mhm,
Also, reduction of risk as well too, right? Care plan is also very important. That's the reason why you will get a lot of questions related to plan of care. It's very important, right?
mhm,
Your reduction risk, as I said, your physiological adaptation, which have what? Acute condition. So acute condition, the most important aspect of care as well, too, right? And other areas
mhm,
that will now come after it. So if you can focus on those important area, safety and infection control, because a lot of students we get prioritization question and infection control question the most. That is what a lot of students get the most. So it's very important. And I know why,
mm,
because I've seen the practice analysis. The practice analysis have arranged everything um related to how important they are. There's difference between NCLEX saying this content have 18%, or this content is 18% of the exam, and how important a particular content is to the exam. 18% just mean that your 85 question, 18% of your question will be from that particular content. Right? Does not mean it's important like that.
mm,
A particular content, NCLEX, like we for the things nurses should know, right? We have 338 for RN and we have 280 for PN. So there's a particular session on the practice analysis that arrange it in level of what? Priority. So prioritization
mhm,
is like top 10. Infection control as well too is like top 10. So NCLEX wants you to
mm.
like, that's how you get a lot of questions like your airborne, your droplet, your contact. How much do you know those contents?
Um, some days are hard to judge myself. Some days I feel like I know it, you know. So most of the days I do, but you know, sometimes you second guess yourself, and that's where I need to stop. But
Oh,
I feel like I know it.